Hello. Today we are going to be talking about mechanical restraints and seclusion. Here are our session objectives. As a result of this meeting, participants will know the legal definition of seclusion, isolation, aversion, timeout, and mechanical restraints, understand when to use and when not to use seclusion, isolation, and mechanical restraints. Participants will know what and how to document this on an IEP. They will also know the state requirements for reporting. Participants will also be able to select appropriate child safety restraint and secure students on the bus. Let's start out by talking about our pillars of excellence. This training falls underneath the people excellence pillar. For our goals and guardrails, this training falls under goal number 4, the percent of schools who met or exceeded expected educator value added assessments, EVAS, growth will increase from 71.7 in October 2019 to 95% by October 2024. Guardrail number 1, the superintendent will not allow inequitable treatment of students and families. Let's talk about seclusion, isolation, and timeout, and what makes them different. Information about seclusion and restraints can be found in the Parent Student Handbook on page number 40 to 41 under the section Permissible Use of Seclusion and Restraints. What is seclusion? Seclusion is the confinement of a student alone in an enclosed space from which the student is physically prevented from leaving by locking hardware or other means, or not capable of leaving due to physical or intellectual incapacity. A seclusion room, timeout room, or cool down space, if the student is prevented from leaving, it's seclusion. So even if it is a calm down space with sensory materials and it's beautiful, it does not matter because if the student is unable to leave with these parameters that we explained for seclusion, then that is seclusion, still seclusion. When can seclusion be used? As reasonably needed to respond to a person in control of a weapon or a dangerous object, to maintain order or prevent and break up a fight, for self defense, when a student's behavior poses a threat, harm, destruction to self, others, or property, when used as specified in the student's IEP, 504 plan, or behavior intervention plan. If seclusion is in the IEP or plan, then the student must be monitored by an adult who is able to see and hear the student at all times. Students must be released upon cessation of the behaviors or as specified in the IEP 504 or behavior plan. Space used must be approved by the LEA. Space must be appropriately lighted, ventilated, heated, or cooled. Space must be free of objects that expose students to harm or others to harm. Seclusion cannot be used solely as a disciplinary consequence or punishment. Seclusion can be used as an intervention as described in an IEP 504 or behavior intervention plan, but this should not be used solely as a disciplinary measure. What is isolation? Isolation is a behavior management technique in which a student is placed alone in an enclosed space from which the student is not prevented from leaving. Let's talk about some examples of isolation. So, when a student is in an enclosed space and they are not prevented from leaving, an example of that might be within the classroom. If you set up a space for a student to calm down, to self regulate, but they're able to leave that space, that would be an example of isolation. If you have a space within the building where you We'll walk the student to a calm down space, maybe a visually calming area, something that helps regulate the senses, then that would be an example of a enclosed space that they are not prevented from leaving from. And that would be an example of isolation. What is timeout? Timeout is a behavior management technique in which a student is separated from other students for a limited period of time in a monitored setting. It's important to see something that is continuous along all of these different management tools, whether it's seclusion, if it's isolation, or if it's timeout. They are monitored in this setting. We would never leave a student alone in a setting unmonitored. What are the differences and similarities? Isolation and timeout are both behavior management techniques. Seclusion physically prevents a student from leaving, but isolation and timeout do not physically prevent a student from leaving. Seclusion and isolation are regulated by North Carolina law, but timeout is not. Aversion procedures. These are strictly prohibited. A systematic physical or sensory intervention program for modifying behavior of a student with a disability which causes or may cause physical harm or psychological harm. Aversion procedures are strictly prohibited in our setting. Now we're going to talk about mechanical restraints. What is a mechanical restraint? A mechanical restraint is the use of any device or material attached or adjacent to a student's body that restricts freedom from movement or normal access to any portion of the student's body that the student cannot remove. When can mechanical restraints be used? When properly used as an assistive technology device included in the student's IEP, Section 504 plan, or behavior intervention plan, or as otherwise prescribed for the student by a medical or related service provider. An example I like to use for this is protective headgear. If you have a student, for example, who is engaging in self injurious behaviors that involve head banging or self injury toward their head, sometimes we can find that those students are provided by their pediatrician or any medical or related service provider. They'll be provided that mechanical restraint, that headgear, and we are able to use that in the classroom if it is provided by a medical means. You can use mechanical restraints when using a child safety restraint system to secure them during transportation, but you must be sure that the child safety restraint system is included in their IEP, Section 504 plan, or behavior intervention plan. We need to make sure that it is documented in that IEP under transportation. As reasonably needed to obtain possession of a weapon or other dangerous objects on a person or within the control of a person. Another time that it is appropriate to use mechanical restraints as reasonably needed for self defense or to ensure the safety of a student, school employee, volunteer, or other persons present. Mechanical restraints, such as tying or taping a student, are not considered reasonable use of force and therefore it is prohibited. Do not tape or tie a student, it is prohibited. Here are some examples of mechanical restraints. So on the top left, you see a chair, and that is one of our chairs that you might see in our classroom, which has the armrest on the side, right? This is not only alternative seating, but it is also a mechanical restraint when it is used with the lap belt. But it's important to point out that the chair itself is not a mechanical restraint. If the student is not being restrained by the lap band, then it's not a mechanical restraint. And in that case, it would just be a chair that's used to support the student in the classroom. Next, we see a wheelchair. This is considered a mechanical restraint because the student is unable to manipulate themselves from the device, but that is something that you would include on the IEP. You want to make sure that it's documented, especially if we're using things in the classroom, such as an activity chair. We want to make sure that those things are documented on the IEP because our students are unable to remove themselves from the seating. So there would be a lap belt, possibly a chest restraint, something to hold them in place in that chair. And we know that sometimes these things are for like trunk support, and that would be noted in the IEP as well. It's important to make sure that we're including these things on the IEP for how they're being used. Next, we see a chair, one of the chairs that we looked at in the first picture, but this chair has like a little bit of added zest here as far as mechanical restraint. So this is something that you might see in a classroom where the student does have mechanical restraint on their IEP, and it describes that they will be seated in one of these alternative seating chairs with a lap band. But this chair is also attached to the table with this is like an elastic band. I've also seen this done with zip ties. You are not elastic banding or zip tying a student to the leg of the table. However, this is a great technique to use to attach the chair to the table because a lot of times we have students who will scoot away from the table. So we know that that can also become dangerous to the student when they are scooting back away from the table, scooting around the room, trying to access something in the room, and they can fall or turn themselves over in the table. I know that we have probably all seen anyone who's used this particular chair. Some of our students get to the point where they are obviously able to touch the ground and they are walking around like little turtles with the chair on their back, and that's just not safe. So this would be an added measure to try to support the student in accessing the educational environment that is in front of them, accessing activities, staying at the table in that assigned area. Next, you're going to see in the bottom left corner, those are elbow immobilizers. Elbow immobilizers can be used for a variety of reasons. This is something that you definitely want to consult fully with your occupational therapist before using. You would need to consult with the occupational therapist before even receiving these. So, these are going to be something used sometimes to prevent students from self injurious behavior. So, if we have students that are using their hands to injure their face or eyes or pull out hair or those sorts of things. And we've used other interventions to try and support a de escalation of that self injurious behavior. This is something, I don't want to say it's extreme, but it's definitely something that you do not want to use lightly or suggest lightly. We want to make sure that we're using every possible measure of intervention before we reach this point. However, there are some students that truly need this level of support. I've also seen this used for students who have a self injurious behavior of stemming on biting and chewing on their fingers. Like that is something that if you fully intervened on it and they're still causing that self-injurious behavior, you want to consult with your occupational therapist on the use of a mechanical restraint like elbow immobilizers. Next, here in this picture in the middle with the purple pants, we see a student who has, we call these wrist buddies colloquially. It is definitely a mechanical restraint. And in this particular situation, this student has a mechanical restraint of a wrist buddy around a glove. So this may be a student who is self-injuring with scratching. Maybe they are again, having that oral fixation of overly stemming and biting on hands, sucking on hands, that sort of thing. And this may be used to support them to decrease that behavior, right? But like I said, there are other things that we want to do before we go to a mechanical restraint. We want to make sure that we are eliminating the possibility that we can decrease this behavior with other interventions. Um, so that is what you're seeing there. Those are some gloves, and they have a little wrist buddy wrapped around the glove. Again, I just want to say that this is something that's going to be provided by your occupational therapist. Please consult with your occupational therapist before using something like this because it does have to be in the IEP. We want to make sure that we're describing its purpose, its function, and we also want to make sure that we are not taping kids because we don't want to be using tape for this. There are special gloves that you can use that have a little bit of like a locking mechanism. There are gloves that you can use with wrist buddies, which you can see in the next picture to the right, but there are other ways to keep these gloves on. I've also seen gloves that they have a little button that attaches to the sleeve of a shirt. So there are things that we can use. You definitely want to consult with your occupational therapist when it comes to these mechanical restraints. So to the right, these are what we call risk buddies, and this may be a student who, again, is engaging in perhaps that self-injurious behavior. Um, and we need to find a way to keep this student from a variety of things. Maybe they are detaching um, the tray table on their activity chair, and they're manipulating out of the seat, and they need that seat for support. This could be when we get into mechanical restraints like this, there are so many different hypotheticals, which is why it's so important to come to your occupational therapist or your physical therapist with the problem and let them be the experts in finding the solution. They know about a variety of mechanical restraints and the escalation that you need to follow in order to meet or reach a certain mechanical restraint. So, in this situation with the wrist buddies, the equitable practice, the best practice would be there were other interventions in place before they came to the risk buddies. We want to make sure that we're testing other methods before we move to something like the risk buddies. And it's for obvious reasons. These risk buddies are not appealing. These risk buddies do not make you happy when you look at them. They do look like another device that would stop a student from using full manipulation of their hands. So, we just want to make sure that we are fully collaborating and making sure that we are honoring the least restrictive environment when it comes to the restraints. What is the least restrictive amount of mechanical restraint that we can use while still serving the student and maintaining safety? These mechanical restraints. So I want you to ask yourself, are these mechanical restraints? And I want you to think about the last slide where I talked about the wheelchair and the different chairs that we have. And when it comes to mechanical restraints, it really comes down to the purpose. If you have a student who is semi-mobile, so a student who perhaps can manipulate around the educational environment, but they become fatigued, and that student is able to manipulate themselves into a chair. Let's use the convoy in the middle. They're able to manipulate themselves into a convoy or an activity chair when they need support during transitions. This student is also able to remove themselves from that restraint or that alternative method of moving. So, are these mechanical restraints? I want you to think about it just with that information. What about wheelchairs and what about standards? Okay, so let's talk specifically about the wheelchairs and the standards. If a student has straps on his or her personal wheelchair, then these straps slash restraints do not need to be documented in the IEP. Alternate positioning, such as a stander, is typically documented in the IEP. So, what we want to do is make sure, and I have also seen physical therapists documenting in the IEP that they require a wheelchair for trunk support. Like you'll see PTs putting different things in there because it's really student specific, right? If you have the student like I was explaining before who's semi-mobile, who's not always using it, that is something you want to document in the IEP because it's unique to them. If it is a student who is using the wheelchair only for transitions or the convoy only for transitions, activity for transitions, you definitely want to document that. If they're using these devices for behavior, that is when we really get into that mechanical restraint space, right? And then the alternate positioning is important to note too, because a stander, and you've probably seen a variety of different standers, is going to be something that's used for alternate positioning. What is the purpose of the device? The purpose of this device is not to restrain a student or prevent them from performing something that requires restraint, right? An alternate positioning device is an intervention used to modify and support students in their growth toward positioning and strength. So that would be a PT. But this is so important too, because this comes back to I know I've said this 100 times, but this comes back to we need to be consulting fully with our related service providers so that we understand why the function of the device that we're using in the classroom and whether or not it is a mechanical restraint used for alternate positioning or whether it is a wheelchair that they use throughout the environment. Educational considerations. Mechanical restraints should not be used as a routine measure to address instructional problems, inappropriate behavior that is not a physical, safety emergency, or classroom management. Prior to using a mechanical restraint for behavior intervention, you want to collect data. So, as we were talking about before, you want to make this an extremely collaborative approach with your related service providers. So, let's say that you're considering a mechanical restraint. You want to be collecting data on sitting tolerance, triggers. You want to be taking that ABC data to really put your best effort into providing behavior interventions. Can we prevent the behavior through typical interventions that are appropriate for the classroom? So that we do not have to have the use of mechanical restraints. You want to utilize those positive reinforcers to promote those desired behaviors. And if needed, you want to complete a preference assessment to determine positive reinforcers. It is not a rule, but a general guidance would be if you are using a mechanical restraint for a student with behaviors, with maladaptive behaviors, we really want to know the function of those behaviors before we're using an intervention such as this. So, a student who is using a mechanical restraint for behavior should possibly, probably err on the side of best practices, have a BIP. They should have a behavior intervention plan because you should be intervening on those behaviors first before we move to an intervention like mechanical restraint. Assess sitting posture to ensure that the student's feet rest firmly on the floor and elbows rest on the table at a 90-degree angle. So, this is something that is also a behavior intervention. We want to make sure that the student is experiencing the appropriate posture. We want to be teaching that almost as a replacement behavior. So, when you see a student who is not sitting four on the floor, it could be. That could be anybody, right? We know kids like to toggle on those seats. There are interventions that you can use, like a bouncy band. You can tie that bouncy band across the front of the seat to give them kind of that feedback, that sensory support. There are techniques that you can collaborate with your OT, your occupational therapist, to provide before we move toward a mechanical restraint. Prior to using that mechanical restraint for behavior interventions, provide classroom modifications for physical and visual boundaries. So, this is another example of an intervention that can be used before we consider a mechanical restraint. So, you want to make sure that the student has a workspace with physical and visual boundaries. And there is an example to the right. This is a workstation that you might see for a student. You want to position the student's work area close to the teacher, so we want to be proximal. We want to position that desk or chair to minimize distractions. And you can see in this particular instance, he is within a barrier of some bookshelves, but he is not prevented from moving from the space, right? We're encouraging the student by decreasing that sensory overload, by putting them in a space with physical and visual boundaries, often with tape. Or tape or a carpet square to designate that area. That's the next thing on the bullets. So you can put tape on the floor around that space. I would say you may not be surprised, but it is truly remarkable how effective this tool is. Some of my most effective classrooms that are dealing with some of these maladaptive behaviors, once they implement those belonged spaces, those designated areas, you see a decrease in behavior. It's important to make sure that you have all of these interventions in place and they've been attempted before you move toward a mechanical restraint for behavior interventions. Prior to using a mechanical restraint for behavior interventions, you want to consider alternate classroom chairs or modifications to chairs that provide natural boundaries and sensory input. You really want to consult with that OT and PT on this. Here are some examples. So, you can use non skid materials on the seat or surface to reduce that excess movement. I'm sure you've seen those before, those like bumpy cushions that go on the chair that give them that feedback, but also decrease the shifting and sliding of the chairs. Those chairs with armrests are an excellent tool without the strap, because once you add the strap, that is considered a mechanical restraint. But attempt to use these chairs with those armrests. They can be pushed up to a desk, and that's not a mechanical restraint because the student is still able to push themselves away from that desk. They are not locked into the desk, but it provides support and it provides a built in designated area within the chair. The desk chair combination for middle and high school students. So in middle and high school, you may see some of those desk chair combinations where they're connected. And this also creates a natural space, a natural designated area for students. And that combined with some tape on the floor can be a real intervention toward providing that space for the student. What we're doing here is trying to provide a designated space with natural boundaries before we implement mechanical restraint boundaries, giving student choice to see if implementing these behavior strategies and modifications to their space and chairs will be effective in their least restrictive mode before we get to that mechanical restraint. Large chairs with fabric and cushions on the seat and armrest, those big waiting room chairs. I'm sure you've seen these in classrooms before. Those big waiting room chairs provide space for the student to sit in a different way. Like maybe they want to tuck their legs up and sit crisscross applesauce. Maybe they want to sit on their knees and wobble from side to side. It really gives them a comfortable seating. And this is really effective for some students. The thing about all of these is they are trial and error, right? You can't just put a kid in a comfy fabric cushion with like the waiting room chairs and say, okay, we tried it. Let's go straight to a mechanical restraint. You have not exhausted options. You have not exhausted what you can exhaust as far as interventions to say that we did our best to avoid mechanical restraint. Wooden desks with the front cut out, you can see that in that bottom kind of to the left picture. It really creates that designated space for the student. An exercise ball is excellent when it comes to our students who are experiencing neurodivergency. We know that our students, some of our students really, really benefit from that feedback and that passive brain movement. It's just like a fidget for your body, right? It really can help them focus. And engagement is key, right? If we can get students to focus and engage and increase that engagement, that is also an intervention. Increasing engagement is an intervention to not have to move toward a mechanical restraint. And unique chair modifications. So we talked about a couple unique things. I have seen such unique chair modifications. I have seen students who have a special chair that has tinsel. So it's one of the wooden chairs and they have attached tinsel to the sides of it. The student loved the tinsel. I have seen students where they have crinkle paper taped to the back of the chair so that when the student pushes back, it makes the crinkling sound because that is something that's appealing to them. This has to be personalized. If we are thinking about moving toward a mechanical restraint, we want to make sure that we know the student who we are moving toward that intervention with, and we are exhausting our efforts to not turn to a mechanical restraint if possible. Prior to using mechanical restraint for behavior intervention, you want to provide sensory support opportunities throughout the day to promote self regulation. Make sure that you're consulting with your school assigned occupational therapist for these techniques. They are going to be able to provide you with some ideas and some collaboration for supports that you can provide. So movement breaks throughout the day, heavy work activities, a bumpy cushion, we talked about that before, a TheraBand attached to the front of the chair legs. I just called it a bouncy band, but that's what I was talking about, a TheraBand. Fidgets or a basket of distractors, weighted vest or pressure vest, quiet calming area. So we could take the time to talk about each and every one of these in great detail, but just to give a little bit of extra on some of these that you may have not seen before. So heavy work activities, this is actually something that your EPECCT can provide you a link to. We have a great document that details some things that you can do with heavy work activities. It's a great little piece of um, resource that can help you in this. And a bumpy cushion, we talked about that, goes right on the seat. It gives them that feedback. That TheraBand is that bouncy band that goes across that they can put their feet on and get that feedback. Fidgets or a basket of distractors is excellent. It's also important to understand that there is a little bit of a difference between a reward and a fidget that is being used as an intervention, right? If a student benefits from an intervention to support their sensory needs, such as a fidget or noise canceling headphones or a Chewy. We do not want to be using these things as rewards. They are things that are meeting a sensory need that our students have, and meeting that sensory need is how we can increase engagement and increase their access to academics and the educational environment in general. So it's very important when you see fidgets or a basket of distractors that we do not confuse that with we are going to reward this student with noise canceling headphones, a Chewy, or a fidget that they require in order to remain focused and on task. A weighted vest or pressure vest, it is extremely important to make sure that a weighted vest or pressure vest is either provided outside of the school by the parent, documented in the IEP, and you must consult with your occupational therapist on the use of this intervention. I would say, please, please, please do not go out to Target and buy a weighted blanket and put it on a student to see if it works, because the use of weighted vests and pressure vests are, um, they are an intervention that is contingent on student weight, student size. A lot of times we find that when people aren't using this intervention incorrectly, it can actually increase behavior, increase stress, and have a negative impact on the student. And a quiet calming area. It is so important to have a quiet calming area in your classroom. This is in an area that can be communal, so it can be an area that is used by all students, or perhaps you have a special area in a classroom that is designated to one student. And as long as the student has the ability to enter and exit this area at their will, then it is not a seclusion and it's not an isolation. So we want to be using those calm down areas, but we also want to be introducing choice. You do not want to be restraining a student to force them into a calming area. It defeats the purpose of the calming area. So, using that calming area effectively is so important because we don't want to create a trauma or an adversity to a calming area by associating it with a timeout or a punishment. Prior to using a mechanical restraint for behavior interventions, you want to utilize communication systems and visual supports, visual schedules, a 5 point scale, first then boards, establish classroom habits and consistent routines to provide structure for stress reduction. So, what you're essentially seeing here is we are going through all of the interventions that we can possibly do before we move toward a mechanical restraint. The mechanical restraint is something that you only consider after you have exhausted all of these options. Any behavior, maladaptive behavior that you're experiencing in the classroom, evidence shows that behavior is communication, right? We know that behavior is a form of communication. So, providing students the ability not only to use receptive language, but expressive language is extremely important. And what does that mean? So, a first then board would be receptive language. You're communicating to the student, this is what you're doing, and then you're going to do this next. A visual schedule is also receptive language for the student. This is what you're doing today. I am providing you this visual schedule. You are going to receive it. This is how I am communicating this language to you. The 5 point scale is an example of expressive language, and it is so important that we use a balance of expressive and receptive language tools when we are communicating with our student. Just like we want to communicate things to our students, we need to give them the opportunity to communicate with us, and that can greatly decrease frustration. I know this is easier said than done, but there are so many tools that can be used to do this. This is something that you want to collaborate with your school based speech pathologist and just brainstorm and talk through things that may be simplified, may touch on social emotional support. There are things that we need to have in place to make sure that our students are able to communicate with us if they choose to in a way alternative to maladaptive behaviors. Maladaptive behaviors is their current communication. A replacement behavior would be a different form of expressive communication. So, one of those would be the incredible 5 point scale. So, you can see a picture of it to the right. This is simply a way to communicate what level of volume that the student is on or is going to be on. So I use this as a form of expressive and receptive communication. So I might present this to a student and say, like, you are currently here. Where are you? And give them an opportunity to say, like, okay, I'm at a 5 right now. I'm screaming and yelling. I'm at a 5 right now. And say, like, where do we need to be? Where should we be when we're in the classroom? Where should we be when we're in the lunchroom? And give them the opportunity to tell you where they need to be. It doesn't stop there though, right? Because And we know that's a perfect scenario. It's not, I mean, not perfect, nothing's perfect, but that is an ideal scenario. They're communicating with you using this. They're not going to do it the first time. You have to teach this. Everything needs to be taught explicitly. When you have a first then board, you can't just put a picture of gummy snacks and a picture of a kid doing math and not have taught the vocabulary. You need to take the time to say, this is math. This picture right here, this is the language for math. You go to do math, you bring the picture with you. What are we doing right now? This picture right here, we're doing math. Give them that total communication in order to make that visual appropriate because it's just like a word. If I introduce you a word that you've never seen before, you're not going to know the meaning of it, right? If I say a word to you that you've never heard before, you're not going to know the meaning of it. I can show you plenty of pictures on symbol sticks that you've not seen before, and it would be a fun game to see if you can guess what symbol sticks codes it as, right? So it's the same thing for our students. Just because you put a picture in front of them does not mean it's self-explanatory, does not mean you don't need to explicitly teach it. So every picture involved in visual communication systems needs to be explicitly taught. We have students who are also pre-symbolic. Students who not only need a visual support, but we may need to move to pre-symbolic and be using object supports. So communication is extremely key. We want to make sure that we're collaborating as much as possible with our speech pathologist to find effective means of communication, not only for receptive language, but for expressive language. Here are some additional resources. The CMS EC Visual Supports website is phenomenal. Everything you need is going to be found right here. You can also use a program within Unique Learning Systems called Symbol Sticks to create your own symbols, create your own visual schedules. There are great tools that you can utilize in that system to make exceptional visual resources for your student to increase communication. What I also recommend is that when you create these visual supports, to collaborate with your speech pathologist to make sure that you're covering your bases and you're using them effectively. What is the most effective means to use and implement these visual supports? If we are working with a student who has never used visual supports to communicate, we don't want to give them a board with 12 symbols, right? But that's too much. We need to make sure that the field is simplified. So make sure that you collaborate with your speech language pathologist for this level of support. If you have implemented all of these interventions, you have taken data, you have tried them with fidelity, and you have exhausted all of these options. If the behavior concern persists, you want to submit a request for support form located in the Exceptional Children's homepage under Requests and Related Links. You can contact your ECCT, grade level ECCT, and they will submit a request for support for you. Decisions to use mechanical restraints must be determined by the IEP team or the Section 504 team based on data collected to support the justification. So once you have exhausted these interventions and the behavior concerns persist, that is when you pull in the IEP team. It must be an IEP team decision and it must be data driven and evidence based. Approved use of the mechanical restraint must be documented in the IEP or the accommodation plan section of the 504 and include the following: the type of restraint, specific activities and duration when the restraints will be used, and a plan to fade the use of the restraint. Right? And this is particularly important with a mechanical restraint because a mechanical restraint should be faded out as soon as possible. So you want to have that plan to fade the mechanical restraint that you are implementing. The mechanical restraint acknowledgement form. It's located on the CMS intranet under the EC homepage, the EC Principal Toolkit, and related Service PT page. It can also be located on page 15 in the EC forms of ECPPI under the miscellaneous forms. The form should be signed at the start of every school year. So if a student is determined to need the mechanical restraint, let's say in April, you're going to get this form signed, and then you're also going to get it signed next school year. It needs to be renewed every school year and considered every school year. as needed depending on the change in equipment or school staff. So it's very important that if there is a change in equipment, this is updated as well. So if the team begins the mechanical restraints with, let's say they begin it with elbow immobilizers, right? And that is documented in the IEP, on the mechanical restraints document. So if you begin with that, but then you fade back to, let's say, the wrist buddies, and these are just hypotheticals, right? You're fading back, but there's still mechanical restraints in place. You need to reassess and redocument that and update it on the IEP. Let's say you have a student who is using an activity chair as a mechanical restraint, and they're also using elbow immobilizers as a mechanical restraint. But interventions are put in place and you fade out the elbow immobilizers. You need to update documentation if you're no longer using those elbow immobilizers and they've been faded out to not include those elbow immobilizers. Why the need for another form? There's a lot of forms in this process. Increased use of mechanical restraints is really the need for this form. We're seeing an increased use of mechanical restraints without IEP documentation and without trials of other strategies. And for that reason, we need to make sure that we are using an acknowledgement form whenever we are restraining kids in the classroom. It's important to take this extremely seriously. Restraining a student should not be taken lightly, and we want to make sure that trials of other strategies have been implemented with fidelity, and we are providing as many supports and recommendations as possible before we move on to this use of a mechanical restraint. Another reason that we need the form is there are lack of plans to fade out restraints. Typically, not typically, but often we see students who are given a mechanical restraint and it remains on their IEP for years and years and years, and it's never reconsidered because there's no plan to fade in place. There needs to be a plan to fade, to remove this intervention, to remove this support. Send the original copy of the acknowledgement form to the EC Administrative Secretary at Historic Collinswood and upload it into ECATS. When using a mechanical restraint, staff must be supervising the student and the situation at all times. You are never, please, 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 never to put a student in a mechanical restraint, such as an activity chair with a waist strap or waistband, and to leave them unattended. It is not a babysitter, it is not a teacher, it is not an adult. It does not stand in for your level of support and supervision. So make sure that you are always supervising that student and situation at all times. Let's get to the law. So here's North Carolina law with reporting requirements. Notice of specified prohibited incidents. School personnel shall notify the principal or principal designee of any use of aversion procedures, any prohibited use of mechanical restraints, any use of physical restraints resulting in injury, any prohibited use of seclusion or seclusion that exceeds 10 minutes or more amount of time on behavior intervention plan. Principal or principal designee shall promptly notify the student's guardian and parent of a situation and school employee name so that the parent can contact the employee regarding the incident. This needs to be done the day that it occurs. So if it is reported that there is a use of aversion procedures, then that needs to be reported to the principal or principal designee, and the parent needs to be notified by the end of the workday or the end of the following workday. Written incident report regarding specified prohibited incident. Parent or guardian of the student shall be provided a written incident report no later than 30 days after the incident. Date, time, location, duration, and description of incident and intervention, event that led to the incident, nature and extent of the injury to the student, name of the school employee, and the parent guardian can contact regarding the incident. So all of these things need to be included in that written incident report. If an employee reports an alleged prohibited use of restraint or seclusion, then no retaliation is allowed. Options when interventions don't work. Child safety restraint systems can be used through an integrated bus seat, star seat, or safety vest. You can see those to the side here. The student at the top is sitting in an integrated bus seat. The star seat is to the bottom right, and the safety vest are to the bottom left. These are all examples of a child safety restraint system, and they must be documented on the IEP in the transportation section. And to remember too, this is an accommodation. So this would be transportation as accommodation, not as a related service. So you would not, if a child is only using a child safety restraint system, under the drop down box that asks if it is a transportation as a related service, it is a no. That is not a transportation as a related service. It is an accommodation. Requesting a child safety restraint system. So this is done through ECATS. You're going to complete and save the student profile, the transportation consideration form that's located in ECATS under the Documents tab. You're going to send this form to your area transportation specialist right there. There's the email there. It's to Pennsauken. And you're going to complete this form for new requests and when there is a change in the type of CSRS. So sometimes what we see as a student is using a CSRS on the bus, and when they get the CSRS, they are a certain size and then they go up in size, right? So you want to complete a new form when you're requesting that bigger size because you want to make sure that's updated on the transportation consideration form. Safety vests. These are used for students who inappropriately unbuckle the buckles on the integrated seats or the star seats and weigh over 90 pounds and are in need of a CSRS. So if your student needs a CSRS, it's been determined it's an IEP decision, IEP team decision. Then if they're over 90 pounds, they are going to need a safety vest. For students weighing 20 to 168 pounds, there are 4 sizes with adjustable zippers. They have leg positioning straps as well, an extra large, small, and medium. Here are some safety vest accessories for larger vests. We have zipper extensions and we also have leg strap extensions. Accommodation or related service. Okay, we just talked about that a little, but let me go a little bit deeper into it. So, transportation accommodations, here are some examples. So, they would include a behavior plan, preferential seating, or a child safety restraint system. So, like we talked about before, the child safety restraint system, the mechanical restraint that we are focusing on right now, that is an accommodation, not a related service. Examples of transportation as a related service would be an additional adult, an address stop, climate control, lift vehicle, modified day, parent contract, shortened ride, or vehicle of less capacity. Both of these things need to be documented on the IEP under that transportation section, but these are the ones to the right that you would do that drop down box and say that they are transportation as a related service. In this example, I would say the student requires a child safety restraint system, or you could say the student requires the accommodation of a child safety restraint system to ensure student safety while riding the bus out. And it's going to be student specific. You're going to put why they actually require it. Thank you so much. And if you have any questions whatsoever about anything that we've discussed, you can reach out to your extensions program ECCT. You can reach out to your grade level ECCT. You can also reach out to your service providers. I strongly encourage, with everything that we spoke about today, service providers first. Talk to that school-based occupational therapist, physical therapist, or speech language pathologist. They are going to be a great resource for information and strategies that you can use to best support your students to avoid mechanical restraint. Thank you so much.